For Senator Alexander as well, your extra 60 seconds bled right into my first 60. How about that? Because that's where I was beginning. Let me say first, I appreciate all your hospitality, the time we could spend at NIH to get a chance to be able to see what's going on. We're all looking forward to quite a bit of what we saw in research and initial levels and in clinicals actually moving out to the general population, getting a chance to be able to see that. Everyone would benefit from things like universal flu vaccines, the Zika vaccine that is obviously progressing, the AIDS vaccine, which has been progressing for a long time and getting closer and closer. Those are remarkable discoveries and will help a tremendous number of people. What's happening in cancer, mental health, and everything else. We very much appreciate the ongoing research as it benefits families all over the country and all over the world. Let me tap into what Senator Alexander was mentioning before about administrative costs, because I want to zero in on just a couple areas. Many areas have already been addressed. One is how grants are done and how they're approved, and I want to talk specifically between coordination. When I talk to grant recipients, they will tell me, I go apply at NSF, and I apply at NIH, and I apply anywhere else where I think it's close, and they're just going after money wherever they can get it to be able to do their research. It is up to the entities to be able to determine, we've got this one, you shouldn't take this one, this is closer to what we're going to do. And the example I would give you is when we deal with law enforcement, they can tell you the lane that DEA has, that ATF has, that FBI have. They know that's not ours, that's theirs. In the research area, that's a little tougher to do. So what I'm trying to figure out, not from the grant recipients, they're eager to go get the grant money wherever they can get it. From our end, how do we help coordinate that to make sure that we do have good coordination, that we're not doubling up on research in other areas, but that we're prioritizing that? And then how do we actually get more research done by reducing the administrative costs? If 40% of the cost of what's happening with the research dollars are just paperwork that's being completed, that's not helping us get to greater discovery. So what can we do to simplify the process on the research and reduce the burden for the researcher, but also make sure that we're coordinating this from a federal level and being strategic?
Senator, those are two great questions. So first of all, just in terms of reducing the administrative burden, we're very intensely interested in looking at ways that might be achieved. Senator Alexander already mentioned this 42% number that came out of that National Academy study. I should point out that 22% of that may be the part that we really want the investigators to do, because that's writing the grant proposal and making sure they've got great science ideas and they're putting them forward, plus giving us annual progress reports so we know what they're actually doing.
Completely agree.
But that still leaves a whole lot of other time. And we have some levers that we can pull at NIH to try to reduce some of those things, effort reporting, for instance, or some of the oversight of conflict of interest, although we need to pay attention to that. But some of those levers we don't hold, and that would require a sort of other discussions to see if there are ways systematically to do those reductions.
How do we discover those so we can help in that?
I think it would be fine for you all to ask us to give you kind of a summary of what the current administrative responsibilities are and where those are decided. We have a pretty good list of those, if that would be useful.
Terrific. I think that'd be very useful and be helpful not only to this committee, but to others, help include it.
And the National Academy recently published a report on this. You've referred to it already, that goes through a good deal of that information as well, but it's a bit lengthy. We could consolidate it if that would be helpful.
Not to increase your administrative burden while we increase others, but we need the help.
And in terms of the very real concern about not having duplication between different funding agencies, we are worried about that and do everything we can to try to nip it in the bud if it's starting to happen. We also have much better tools now for doing analytics of what's in our portfolio and what's in the portfolio of the National Science Foundation or the Department of Defense's medical research efforts or the Department of Energy's efforts. And we are looking at those with increasing intensity now to be able to identify if there are unintended duplications. Sometimes it's good to have some efforts going on in different ways. Certainly with NSF, we have a lot of areas where we specifically coordinate. The BRAIN initiative, for instance, is one where NSF, NIH, and DARPA, and a few other organizations have a big role, and we are meeting regularly with them to be sure that's going the way it's supposed to. In some other areas, we have a pretty good swim lane definition. Take genomics. NSF does plants. And the USDA does agricultural plants and animals. NIH does those that are relevant to human health, and we keep pretty good taps on those things. But we do ask every investigator when they send us a grant, they have to list their other support. And if we're going to give them the grant, we have to look at that and make sure that what they've put there doesn't sound awfully familiar to what they're asking us to do. And we will go and ask them very carefully if that's the case. So I think for the most part, we don't have a lot of unintended overlaps. But I think these new tools that we've developed may be an opportunity to do an even better job of that. I'd love to follow up with you on how we
Yeah,
can
and
do that.
I understand the grant recipients have to list where they're getting other fundings, but if they're simultaneously applying for other areas, that's the area that I see as the weak spot in that. And there has to be some way to be able to help coordinate to say, we've got this part of it, you've got this part of it, and we've got to figure out who's got what lane because we need all the research done and need it done efficiently.
With you.
Thank you.
Thank you, Senator Lankford. Senator Shelby.